opioids, and as a person who's been living with pain for over 20 years, opioids are a big part of my pain treatment. And I have been hearing such negative things about opioids and the risk factors of opioids. Could you talk to me a little bit about that?
Well, the general belief system in the public is that the opioids are a bad thing to be giving a patient. Unfortunately, it's also prevalent in the medical profession. So the patients have difficulty finding a doctor when they're suffering from pain for a long period of time, especially moderate to severe pain. And that's the patients that we really need to use the opioid methods of treatment because they're the ones that need to have some help with their function, and they're the ones that need to have their pain controlled enough so that they can increase their quality of life.
This is what has allowed me to continue to function. It is what allowed me to have somewhat of a normal life, is the opioids. The
job of the physician that's prescribing the medication is to monitor how you do each time you come in. And it's very important that the doctors see you frequently, especially when you first start the medication, so that we can see what kind of effects it's actually having on you. We also like to get some input from the families because that gives us some ideas as to how the patient is actually functioning, whether they've improved their function from before the treatment as opposed to now. And we don't necessarily depend on pain scales. In other words, if a patient has pain of a 10 over 10, and now we can give them medications to help their pain, they may go down to an 8 or 9 or maybe even a 7 over 10. But if they're increasing their function, that's the purpose of giving this medication. Everybody's different. Genetically, people respond differently to all the medications. So we want to find out if a particular medication that's being prescribed is doing what we expect it to do. And that's the responsibility of the doctor.
Well, I do not have a pain management doctor. I have just a basic family doctor who handles my
That's great.
Pain. Great. Is there anything that I can do to help him?
Well, there's a lot of information out there that's available, and the websites are actually abundant with various tracks of information. The biggest thing I think that the doctors don't understand about giving medication is that they have to document. The documentation is probably the most important aspect of administering the medication to show that what you have and what you suffer with is deserving of being treated, and also that the goals that have been set forth in doing the initial examination and the follow-up examinations are actually coming to fruition with the treatment you're getting. If you're not getting appropriate response with it, it might be that particular medication wasn't appropriate for you. So that's the other responsibility that the doctor has, is to determine what medication would help you the best.
And I know my doctor and I have had a lot of discussions about what my responsibility as his patient, you know, what my responsibility as far as to make sure that my medications are safe and secure at all times.
It's a good point. I require that my patients at least purchase a locked container, and if there's a theft, and sometimes it happens, you know, especially in this day and age, sometimes a burglary or something like that can occur. If your medications are out in the open or easily found, they can be diverted. And this can happen with open houses, for instance, and various, or if repair people come into your house. So you should have some kind of a security system for your medications. That is one of the things that we would require of our patients. What kinds of things can you do now that you could not do before you were put on this medication program?
Walk.
Okay.
Yeah, I had a really hard time walking. I was actually in a wheelchair for a period of time.
Okay.
Before we went to opioids, you know, so now I function like a person who's not in pain, you know, because of that. I can function somewhat like a person who's not in pain.
Do you participate more with your family and friends? Do you socialize more than you did before?
Yes, yes.
That's important.
Yes, and it allows me to babysit my grandchild.
Aha, see?
Before, I couldn't have done it.
That's your quality of life.
Exactly.
And that's what this medication is meant to do, is to restore quality of life. The things that we do is that I go through all the medical records that the patient has beforehand. And this is before the patient even comes in. We now have in the state of Minnesota a prescription monitoring program in which we can then look into the history of the patient, and we can see if the patient has been doctor shopping or going to different pharmacies, or some of the components that might make a risky patient as far as the doctor is concerned. We also do a thorough examination on the patient to find out if in fact the findings that we have in the examination now are consistent with the findings that other doctors have had in the previous evaluations, and then to determine whether or not the medication we're going to prescribe would be an appropriate approach for you. Mm-hmm. So one of the things we do is we have the patients fill out these various instruments that we have to determine relative risks. And what kind of a background have you had as far as alcohol or other drugs? Have you been treated by chemical dependency or chemical abuse programs? And then we also take into consideration the history that you gave us. And if everything fits together with the history we've had from other physicians, which may or may not be biased toward the medication or not, we then make a decision as to how we're going to treat you. What we do typically is we have the patient fill out or answer the various questions that are necessary for the opioid agreement program that we have. It's a form that you okay the various codicils that are on the paper that we give you, the document, and then you sign it, I sign it, and one of my staff members sign it. And in that, it includes the fact that you would go to one pharmacy, preferably. Of course, if you're working one place and you're living another place and you have two pharmacies, we can work with that part. Mm-hmm. The other thing is that you agree that's just going to be one physician that's going to prescribe the medications. We have to know if something changes. If you fall down, break an ankle, or fracture a wrist, or whatever may be the case, and you're going to require more medication to cover that incident, as opposed to the ones that you've been suffering with all the way along. We have to know that. You have to call us, let us know. You can't let it go to the end of the time that you fill your prescription. You got to let us know beforehand so we can get it documented, and we can discuss with you what kind of medication changes we should make to cover the new injury. Same thing is true if you go in for surgery. You'd have to let us know so we can discuss up front what's going to happen for you with the anesthesiologist and what should be done after the surgery to make sure that not only are you covered with the pain that you had before, but also the pain that you're going to have as a result of the surgery. So we also have systems. We do pill counts. We do urine drug screens. I do serum level studies as well to compare them to some publications that have come out comparing how patients do with low doses as opposed to high dose medications. We all have different genetics, so everybody responds differently. The other thing that we have as a requirement is, of course, that you come in frequently at first, and then as you become a stable patient, we can set the evaluations out further apart. If, in fact, we now come across a medication for some reason or another in which you develop an allergy, skin reactions, GI distress, something to that effect, we always make sure that you don't get constipated because that's one of the side effects of the opioid medication, so that's another issue that has to be addressed. And then if something happens so that particular medication does not work well, then we have you bring the medications back into us, we count them, we can work out a system of destruction, either with one of the waste management organizations, and we then dispose of the medications appropriately so that they do not get into our water supply.
Well, Dr. Anderson, this has been very educational.
Well, it's been great to just sit down and talk to you. It's been a great experience.